You need to watch this if you struggle with understanding trauma. Trauma. It's a word we hear often, but what does it truly mean? Trauma is not just about terrible events. It's about the lasting impact these events have on our minds and bodies. It's about the way our nervous system reacts to overwhelming stress. Trauma leaves its mark, changing how we experience the world. We used to think trauma was rare, something that happened to soldiers or victims of natural disasters. Now we know better. Trauma is much more common than we thought. It can stem from abuse, neglect, violence, accidents, or even systemic oppression. It can affect anyone, regardless of age, background, or social status. Trauma doesn't discriminate. It doesn't just vanish with time. The effects of trauma can linger for years, even decades, after the initial event. It can manifest in a myriad of ways: anxiety, depression, flashbacks, nightmares, and chronic pain, to name a few. Understanding this complexity is crucial for providing effective care. We must move beyond simply asking, "What's wrong with you?" Instead, we need to ask, "What happened to you?" This shift in perspective is fundamental to trauma-informed care. Section 2. Scars that run deep. Trauma's impact on the brain. Trauma changes the very structure and function of the brain. It particularly affects areas like the amygdala, hippocampus, and prefrontal cortex. These regions play crucial roles in emotional regulation, memory, and executive function. When these areas are affected by trauma, it can lead to a range of challenges. The amygdala, our brain's alarm system, becomes hyperactive. It perceives threats everywhere, even when there is no real danger. This can result in constant fear, anxiety, and hypervigilance. The world feels like a dangerous place, making it difficult to relax and feel safe. The hippocampus, responsible for processing and storing memories, is also impacted. Trauma can disrupt its normal functioning, leading to fragmented memories and difficulty recalling details of the traumatic event. This can create a sense of confusion and disorientation. The prefrontal cortex, responsible for higher-level thinking and decision-making, struggles to function optimally. This can lead to impulsive behavior, difficulty concentrating, and challenges with emotional regulation. The ability to think clearly and make sound judgments is compromised. Understanding these neurological changes is crucial for developing effective treatments. Trauma-informed care recognizes that these brain changes are not character flaws, but rather adaptations to overwhelming stress. It emphasizes compassion, patience, and a focus on healing the underlying trauma. Section 3. Childhood disrupted. The enduring effects of early trauma. Childhood trauma, in particular, can have profound and long-lasting effects. During these formative years, the brain is still developing rapidly. When trauma occurs, it can disrupt this development, leading to significant challenges later in life. Early childhood experiences shape our understanding of ourselves and the world around us. When these experiences are marked by trauma, it can create a distorted view of relationships, safety, and trust. These early beliefs can continue to influence our thoughts, feelings, and behaviors well into adulthood. Children who experience trauma may struggle with emotional regulation, social skills, and attachment. They may have difficulty forming healthy relationships and experience challenges in school and other social settings. The impact of early trauma can permeate every aspect of a child's life. It's essential to remember that children are incredibly resilient. With the right support and interventions, they can heal and thrive. Trauma-informed care recognizes the importance of creating safe and nurturing environments where children feel seen, heard, and understood. Section 4, a ripple effect, trauma and long-term health. The impact of trauma extends far beyond mental health. In the 1997 CDC and Kaiser Permanente study, the researchers surveyed 17,000 adults, middle-aged, white, middle income, and counted adverse childhood experiences, ACEs. They named 10 different ACEs. In this study, 2/3 of participants had at least one ACE. 12% had 4 or more. It can have serious consequences for physical health as well. Studies have shown a strong correlation between trauma and a higher risk of developing chronic illnesses, such as heart disease, diabetes, and autoimmune disorders. Adverse childhood experiences are the most basic and long-lasting cause of health risk behaviors, mental illness, social malfunction, disease, disability, premature death, and healthcare costs. As the ACE score increases, so does the risk for smoking, 2.2, multiple sexual partners, 3.2, adult alcoholism, 7.4, drug use, 4.7, STDs, 2.5, depression, 4.6, suicide attempts, 12.2, pulmonary disease, 3.9, heart disease, 2.2, liver disease, 2.4, lost time from work, 2.5, and early death. Those with an ACE score of 6 or more die 20 years earlier. Trauma keeps the body in a constant state of stress. This chronic stress triggers the release of hormones like cortisol and adrenaline. Over time, these hormones can damage the cardiovascular system, weaken the immune system, and increase the risk of developing chronic inflammation. The link between trauma and chronic pain is particularly significant. Many individuals with a history of trauma experience persistent pain that cannot be fully explained by physical injury or illness. This suggests that trauma can alter the way the brain processes pain signals, leading to heightened sensitivity and chronic pain conditions. Addressing trauma is not just about improving mental health. It's about improving overall well-being. Trauma-informed care recognizes this interconnectedness and takes a holistic approach to treatment, addressing both the physical and emotional consequences of trauma. Section 5. Shifting the paradigm, the essence of trauma-informed care. Trauma-informed care represents a fundamental shift in how we approach mental health. It moves away from the traditional medical model, which often focuses solely on symptoms, and embraces a more holistic and person-centered approach. It's about understanding the individual's story, not just their diagnosis. At its core, trauma-informed care is about creating a safe and empowering environment for healing. It recognizes that traditional therapeutic settings can sometimes feel re-traumatizing for individuals who have experienced trauma. What does it mean to provide trauma-informed services? It means that One Brooklyn Health delivers services in a manner that acknowledges the role that trauma, violence, and victimization plays in the lives of many people seeking these services in our communities of East and Central Brooklyn. Trauma-informed professionals. 1. Appreciate the high prevalence of traumatic experiences among our patients. 2. Understand the profound neurological, biological, and social effects of trauma and violence. 3. Engage with patients in a manner that recognizes and addresses trauma-related issues. 4. They are collaborative, supportive, and skilled. These services seek safety first and commit themselves to do no harm. Therefore, creating a sense of safety and control is paramount. It's beneficial to know that patients, and especially youth who have experienced trauma, can heal, especially within positive and protective relationships. Being aware that sometimes our services designed to help patients can be, and often have been, inadvertently re-traumatizing. 6 key principles of trauma-informed care in any organization or system of care that One Brooklyn Health strives to live by. 1. Safety. Ensure both physical and psychological safety for staff and patients, youth, families. 2. Collaboration. Partner with patients, youth, families, and all staff to meaningfully share power and organizational decision-making. 3. Voice and choice. At One Brooklyn Health, staff are not just controllers of healing, but facilitators. They partner with patients, youth, and families in shared goal setting and determining the plan of action. Self-advocacy skills are encouraged for all. 4. Trustworthiness. At One Brooklyn Health, we believe that trust is the cornerstone of effective care. That's why our organizational operations and decisions are conducted with utmost transparency, with the goal of building and maintaining trust for all involved with the organization. 5. Peer support. Peer support and mutual self-help are key vehicles for establishing safety and hope, building trust, enhancing collaboration, and utilizing stories and lived experiences to promote healing. 6. Cultural, historical, and gender issues. Some people bear an extra burden of trauma based on belonging to a specific group. Incorporate policies, protocols, and processes responsive to the racial, ethnic, and cultural needs of the individuals served, and recognize and address historical trauma. It's about building a strong therapeutic alliance based on mutual respect and understanding. Clients are not passive recipients of care, but active participants in their own healing journey. Trauma-informed care is not just about techniques or interventions. It's about an attitude, a way of being with another human being who has been deeply wounded. Elements of trauma: informed environments, safety precedes learning, fear overrides the ability to think clearly, behaviors communicate feelings, environment and activities can calm relationships, can heal, nonverbals are powerful, teamwork and shared responsibility are vital connections across systems improve outcomes. It's about listening with empathy, validating their experiences, and empowering them to reclaim their lives. Handling disclosures of trauma. Be prepared. Expect disclosures from patients. Know One Brooklyn Health policies and protocols. Know New York State reporting laws. Discuss confidentiality and reporting requirements with patients. Have referral info available. After disclosure, by patients. Acknowledge and validate patients for sharing. Remind them about confidentiality and reporting requirements. Follow up and stay connected during the inpatient encounter or outpatient experience. Neuroplasticity, the amazing capacity of the brain to change its molecular, microarchitectural, and functional organization in response to injury or experience. Neurogenesis happens in the hippocampus and the cerebellum, back of brain stem. Neural networks are the intricate connections of neurons, dendrites, and glia within the brain. They serve as the pathways for thoughts and neural impulses, enabling the brain to function. The saying neurons that fire together, wire together, encapsulates the idea that repeated neural activity strengthens these connections, shaping our brain's structure and function. Strategies used to address patients who have experienced trauma. The best strategy is to begin with yourself. Manage your reactions. Recognize that the patient's behavior is communicating feelings or loss of control. Validate the patient's emotions, then guide them toward calm. Limit questions. Could you call on practice proactive strategies and exercises? Then you will be able to calmly and rationally support the patient. Regulate. Consider the environment. Create quiet, safe spaces. Please keep in mind the lighting and background noises. Encourage respect for personal space. Develop predictable routines for patients on inpatient. Could you provide advance notice for transitions and changes in routines? Create opportunities for sensory organizing movement throughout the day. Regulate. Proactive strategies. Reorient to the present. Helping the patient to focus on the immediate environment is also known as grounding. Imagery, breathing, mindfulness, meditation, yoga, exercise. Teach about the brain and senses and how they react. Here are some additional suggested strategies that can be included in your work with patients that also address and integrate their sensory experiences. Oral sensory strategies: chewing gum, biting nails, eating snacks, sucking on hard candy, chewing on a pencil, etc. Movement strategies: rocking in a chair, running in the hallway, bending over, dancing, working out, fidgeting, or moving in your chair. Touch strategies: twirling your hair, squeezing a stress ball, holding something soft in your hand, petting a dog or cat, fidgeting with an earring or necklace. Auditory strategies: listening to a particular type of music, humming to yourself, and using headphones to drown out noises. Visual strategies: watching a fire on TV, watching a fish tank, reading a book, or watching a lava lamp. Modify the light, brighter or dimmer lights to feel calm and attentive. Sensory strategies for over-responders: slow and low activities, relaxation, coloring, heavy work activities, rhythmic head-to-toe movement, rocking, yoga, repetitive activities. Calm yourself, warning about transitions and future events. Surprises, environmental strategies include comfort, water, snacks, low light, sensory strategies for under-responders. Use alerting, fast or intense sensory inputs. Use stimulation of taste and smell, sour, hot, mint, aroma. Bracelets. Find and tap into the patient's motivation incentives. Use color to enhance attention. Slinkies or other fidgets, pencils, etc. Physical activities, stretches, toe tapping, blinking, figure 8. Strategies for sensory seekers, cravers. Use tactile, smell, taste, and vision. Create organized movement experiences, goal-directed and purposeful. Involve the patient in purposeful heavy work tasks, moving desks. Environmental modifications, fidgets, Velcro on the desk. The second step in the strategies approach is to relate. The connection between patients who have experienced trauma and staff is essential to the healing process. The brains of patients who have experienced trauma may have learned to associate staff with negative emotions. Patients benefit from positive interactions with staff. First, regulate with the patient, then relate. The tone of voice and volume, patient's relational needs. What communication modes will support them at this moment? Body language to support a relationship? Positive communication. Listen without trying to solve. Avoid trying to make it better. Relate. Build empathy. Reframing the lens. We use to view patients as important and beneficial in our work with them. Look to understand what is being communicated and why. Celebrate the successes and progress seen, even if it's as simple as, "You are here." Reframe. What happened to you? Not, "What's wrong with you?" Reframe. Symptoms are adaptive coping necessary to survive, not as a pathology. Reframe. Behaviors are communication that can lead to understanding. PTSD symptoms are typical reactions to atypical circumstances. The individual is a survivor. Celebrate their survival mechanisms. Finally, the last strategy I recommend in our approach is to reason. This strategy utilizes the brain's prefrontal cortex to learn and problem solve. Focus on restorative practices, relational repairs, and future strategies to assist the youth in responding appropriately next time. Think consequences versus punishment. Consistent and individualized responses. Appropriate to the developmental stage. Consider triggers and experiences. Retain patients, especially youth, in learning services. Consider the function of behavior and encourage skill development. Help patients, especially youth, to recognize the impact. Please be aware that change is slow and incremental. These suggestions for how we view our interactions and work. Reframe negative behavior as a growth opportunity. Review strategies used and consider the need for modified or new strategies. Support autonomous decision-making and independent functioning. Emphasize students' ability to make changes. Foster hope. Celebrate healthy insights and change. Provide pro-social opportunities and encourage restorative practices, community interaction, and support. Focus on future strategies. In psychiatry, we can design physical environments and processes that encourage self-regulation and avoid trauma triggers. There is the possibility that patients may, unconsciously, draw others into recreating traumatic circumstances or events to develop some control or mastery. Trauma and sensory-friendly environments have routines and consistency, choices, clear, firm limits for inappropriate behavior, sensitive to environmental cues that can trigger reactions, anticipate difficulties, and provide additional support. Provide warnings, understand trauma reenactment. Before we move on, take a moment to check in with yourself. Reflect on the following questions. Consider discussing how this information resonates with you and your work on your unit, colleagues, or even with your friends and family. Next, we will discuss the effect of other people's trauma on us as mental health providers. 1. What is your reaction to the information so far? 2. Did anything surprise you? 3. Does it change how you see the patients you work with? How so? 4. Can you think of patients you work with who have any of these behaviors? 5. How does traumatic stress affect the patients and families you work with here in East and Central Brooklyn? Section 6. Navigating compassion, fatigue, protecting the healers. Working with trauma can be incredibly rewarding, but it also takes a toll. Professionals in this field often experience compassion fatigue, a state of emotional and physical exhaustion that can arise from caring for others who are suffering. It's essential to recognize the signs and take steps to mitigate its impact. Compassion fatigue can manifest as emotional numbness, difficulty feeling empathy, irritability, difficulty sleeping, and feelings of hopelessness. It's crucial to remember that compassion fatigue is not a sign of weakness, but rather a natural response to bearing witness to others' pain. Preventing and managing compassion fatigue requires a multifaceted approach. This includes setting healthy boundaries, engaging in regular self-care practices, seeking supervision and support from colleagues, and prioritizing personal well-being. It's also essential to recognize the importance of taking breaks and engaging in activities that bring joy and renewal. Organizations also play a crucial role in creating a culture of support and self-care. This includes providing adequate training on compassion fatigue, promoting work-life balance, and fostering a sense of community and support among staff. When professionals feel supported, they are better equipped to provide compassionate and effective care. Section 7. Cultivating resilience. The importance of self-care in trauma. Work. Self-care is not a luxury. It's a necessity, especially for those working in the field of trauma. Engaging in regular self-care practices helps to build resilience, prevent burnout, and maintain emotional well-being. It's about prioritizing our own needs so we can continue to show up for others. Self-care looks different for everyone. It's about identifying activities that bring joy, relaxation, and a sense of renewal. This might include spending time in nature, engaging in creative pursuits, practicing mindfulness or meditation, connecting with loved ones, or simply taking time for quiet reflection. It's also essential to prioritize physical health. This includes getting enough sleep, eating a balanced diet, engaging in regular exercise, and avoiding unhealthy coping mechanisms, such as substance abuse. Taking care of our physical health directly impacts our mental and emotional well-being. Remember, self-care is not selfish. It's an act of self-preservation. By taking care of ourselves, we are better equipped to care for others. When prioritizing our well-being, we can show greater compassion, empathy, and resilience in our work with trauma survivors. Could you reflect on what we have discussed? 1. What personal professional boundaries do you create for yourself? 2. Who is there to help you manage the stress of your job? 3. Where do you feel supported at work? Peer supervision, consultation? 4. What steps can you take to support fellow staff in your unit?